Hello.
Hi.
Thanks,
Lovely to
Andy,
be
for
here.
that generous introduction. So, Rose, how many people have read Rose's book, Suckers?
It wasn't recently released, just to say that to be factually correct, but a few years ago, yeah.
So how would you describe the book for people who haven't read it?
It's a book that looks at alternative medicine in the... it's an evidence-based polemic. I think that's the best way I can put it, about alternative medicine.
So what's the difference between, you describe it as a polemic, as a journalist, what made you decide to get into polemic as opposed to just a journalistic review?
A kind of ongoing impatience that had built up to a frenzy, I suppose, about alternative medicine. Particularly, I was working a lot in women's magazine journalism, and certainly in the 90s, the caring 90s, whatever they were meant to be, there was a lot of it about, and it was never questioned. And I felt, because I was committed to kind of accurate information giving, that there was a lot to be done in questioning it, but nobody wanted to hear at that point anybody naysaying any of it.
Were you surprised by the way that these sorts of alternative medicine treatments are portrayed in the print media?
Not really, because it kind of, certainly in women's magazine journalism, it fitted in very, very well into kind of self-help vagueness and verging on the beauty pages. It's just entertainment of that kind. There's a lot of it about there.
Well, why do you think that is? I think that there's maybe some distrust among a lot of people of, I guess, mainstream medicine, for lack of a better word. I think people here might just say it's just medicine.
Yes.
If it works, it's medicine. Yes. Why do you think, is there a certain group of people that you think maybe distrust that above others?
I think I doubt it. I think the middle-aged, middle-class women are the biggest users of alternative medicine across the world, and so that fact alone explains the interest in women's magazines.
But why do you think that they're more interested in it in the first place?
I think there are loads of reasons. I think it's a kind of an individual empowering, I think, that often comes from becoming a kind of wise woman in your own home. And picking the homeopathic remedies or taking your child to the cranial osteopath or whatever. And I think that's very, very appealing. I think in a very crude sense, there are a whole bunch of women who it's a way of getting touched and cared for at a point in their lives they feel perhaps they're not getting touched or cared for.
Well, I think at least in the U.S., there's a big conception of the pharmaceutical industry as this mammoth, profit-driven, inhuman monster, and why should they really care about anybody's health? I mean, we were talking before this interview about this guy in Houston, Texas, Dr. Stanislav Berzinski, that's been doing these alternative cancer treatments. Yes, here's some hisses. Yeah, for those who don't know, he's under the auspices of the Food and Drug Administration. He's in clinical trials to treat people with cancer with this therapy that's not been proven to work ever, and he has not published any results showing that it does in any reputable medical journal for a long time. But one of the things people who are defenders of his always point out is that if medical science developed a cure for cancer, it's in their financial interest to not make that public because they make so much money off of pills and radiation and things like that. So what do you say to people who...
Well, I mean, I think a very good thing to say is something by the guy who runs Quackwatch in the States, who points out that when a cure for TB was found, the iron lung industry didn't try to repress that information. We know that's not how science works. We know that if people did find whoever it is or whatever group of people find a cure for cancer, they will be delighted for very, very many reasons, not least because they've got members of their family who have experienced cancer. So I guess it's incremental, isn't it? You try to make those small points, to raise those small questions that get people slightly question that particular belief.
Do you have any idea how financially large the alternative medicine world is? I know that's a huge encompassing term.
I don't think anybody does. I mean, if you can make, Mintel can make estimates at what is going to be worth this many trillion by 20 whatever, but it's very hard to quantify because it is so fragmented in a way. So the amount of money that's spent in the NHS is impossible to gather because it's not audited in that kind of way. There is no list where people can say how many clinical commissioning groups now, how much each one is going to be spending on homeopathy. They will not be centrally gathered, so we don't know.
Yeah, but it seems to me that there's a huge profit margin in, I've been inside in the health food stores and seen these supplements that are, in the States, it's like $100 for a small bottle of pills.
Yeah, or Rescue Remedy, which is just cheap brandy with a tiny little bit of water in it. In these do you have that Rescue Remedy?
Yes.
It's marvellous because it's brandy, which is great. But it's a teeny amount, and they sell it for something that works out to be nearly £700 a litre if you break it down. So which is incredible that it's possible to do that.
Mm-hmm. And they're still seen as the underdog by
and often things are, when I was researching the book, finding things like when the brandy actually does have a value, but when you're selling people sugar pills, that's pretty cheap, and you can buy those pillules, as they call them, in bulk from suppliers, and other people, quite often, the other thing people sell and call it something else is salt, which is a really cheap commodity. So, they're onto a winner, clearly.
Yeah, absolutely.
Yeah.
And it makes your food better.
Yes.
Until you keel over from all the sodium.
Forget about that.
So which do you think is the most, of all of these treatments, your book acts as sort of an entry point for people who maybe if they've never heard of the medical science behind alternative treatments. Everybody's heard of what you write about in your book, chiropractic, and, homeopathy and things like that. There are a lot of people still, though, who don't know how those things work, and you sort of break that down in a way that's easy to understand. Have you gotten any response from people who weren't aware of how these things work? I mean, this audience is, I think, for the most part, savvy about how chiropractic works, what homeopathy is. But have you heard from anybody who didn't know before they read your book?
I think, I will also be familiar with a lot of people think that homeopathy is herbal medicine, and they muddle it all up. And so when you say there is actually no active ingredient in those homeopathic pills, and once they've got over the shock and check it out and find that's true, I think, it's those little kind of, you just get out the little chink, the light under the door, would say a little fact like that then opens up a bit of scepticism for the rest of it. But some of them seem to be out of bounds in a weird way that they couldn't believe I could be questioning. So if you say, well, alternative medicine, what do you mean by alternative medicine? Everything that calls itself alternative, everything, even acupuncture, as if that's sort of beyond, even acupuncture. And that has gained a kind of status, as has to a certain extent, consider it's an osteopathy and then chiropractic, because it's kind of in the establishment slightly. It has names for its bodies that sound, kind of parallel universe names that sound a bit like orthodox acronyms. I think probably when you talk about it's very confused because you can talk about the damage that alternative medicine can cause in itself, say like a neck injury from chiropractic from which you might die or have a life-changing stroke, or you can talk about the uselessness of it and therefore the danger of it, which, homeopathy for a brain tumour. So it's the mixture of those things that I try to communicate, the risks and the avoidance of benefits from orthodoxy, and it's a complicated thing.
Sure, yeah. There are a lot of treatments that may not be harmful to someone who isn't in a state of ill health, but if someone has cancer and they're going to a chiropractor and not going to a real doctor, it's a big deal. Do you know, one of the things that I thought was a great way to open your book is this I think it's maybe one of the first things that you write in your book is that ancient Chinese medicine is not ancient at all. These things that people, a big selling point for alternative medicine, it's been around forever.
Ancient wisdom, yeah, great. I think, again, that's something that people find very hard to accept, that because there are things in it that are ancient, but it's not a kind of cohesive discipline that has been moved intact from the past to now, and it was a political thing in post-revolutionary China because they couldn't afford to do Western medicine, they couldn't afford to do scientific medicine, and it had an ideological point to it because people felt they were being in some way cared for by the state, and it was the only feasible way of dealing with people medically. But it also, within it, has got lots of, makes political, its structures and ideas are very similar to other ideas within the Chinese Communist Party, which I didn't know actually when I started researching this, that was the case, and that was one of the biggest surprises for me when I was doing it.
Can you take us through a brief history of how that infiltrated what we can, I guess, for lack of a better term, Western mainstream?
Well, I think your compatriots have got to take the blame for this.
Oh, great.
Yeah.
We're number one. USA!
Yes. When you'll have the dates, what date did Richard Nixon go to China?
You say I will have that date.
Yeah.
And you are clearly mistaken.
Well, it was early 70s?
It was the early 70s.
Yes. He went to... and there's an opera written about it called Nixon in China, which is a fabulous opera by John Adams, which I'd recommend. When he went to China the first time, it was a huge event politically and culturally. It's hard to really credit it now, but it really was. And he had a big party with him. He had doctors and journalists with him. And the one particular thing that happened, forgive me if you already know this story, an American journalist developed appendicitis, and he was in the press corps following the president around, and he got admitted to a Chinese hospital, and he had a kind of post-operative pain crisis, and they gave him acupuncture. I think they did moxibustion when they put that burning thing on a... Anyway, they did something like that, and he had the experience of the pain in his stomach going away, and he wrote a big feature about it for the New York Times, and everything coincided with the opening up of sort of East and West, the lifting the bamboo curtain, as people call it, and that. And then quite soon after that, a book was translated and distributed in the States, which was a Barefoot Doctor's Handbook, which had all that stuff in and was very popular on the West Coast. And that's kind of how it went. And then it became worldwide, sort of fed back again.
Sure. I mean, I've heard people blame the hippies, but people always blame the hippies for everything. Let's lay out the hippies for once. But it did definitely, whatever happened, it seems to have exploded very quickly, because between the early 70s and then by the early 80s, these psychic surgeries were all the rage. People flying to the Philippines to get their tumors removed by sleight of hand artists.
Chicken entrails pulled out of people's hands, yes.
Yeah, which is, if it took just a decade for that to become entrenched, then obviously this was latching on.
Clearly there was an appetite, and there was it coincided with lots of other anti-authoritarian ideas and ideas of returning to the land and somehow communing with nature that people projected to an extent on that area.
And now it's, like you said before, it's infiltrated in mainstream medicine, and people have the option under their insurance or under their health plan, their National Health Service, of getting things like acupuncture. How did that happen?
I think there's always been, in Britain, there's always been a small amount of it. In the 40s and 50s, there were quite a lot of osteopaths who still were around at the beginnings of the National Health Service here. And it tended to, as the National Health Service became more used by everybody, it tended to slip away. And it was when that the 1960s, 70s hippie revival came back, brought it, or coincided, that it started to be, say, an example, a very good example, I think, is health visitors recommending cranial osteopathy for crying, babies crying with early colic. And that is very, very frequent and goes on and on and on, because it's what can you say to this desperate mother who hasn't slept for however many weeks. Perhaps you might find it useful at the point, this is the point where that infant colic actually normally stops, which is 3 months. Everybody's beside themselves at 3 months. You take your baby to the cranial osteopath, the baby the next day is better. So certainly, and that's another good example of where it's impossible to know to what extent, apart from just anecdotally, this is through the health service. But and some of it's within actually health service provision, and other is making referrals or recommendations to use alternative medicine.
And I know that in the States anyway, because we're not evil socialists, we have to pay for our health care. We have the freedom to pay out the nose for our health care. There are insurance companies who will suggest that you go to a chiropractor before going to a medical doctor, because sometimes it's cheaper for the insurance company to refer you to a chiropractor. And so there are a lot of people, like we said, who may have serious illnesses that they're deferring in lieu of a real medical treatment. They're getting this alternative therapy. There are a lot of people, though, who just will go to a chiropractor because they have a backache and it makes them feel better, or they have a little bit of joint pain, or go to an acupuncturist and it makes them feel better. What do you think are the ethical implications of that? I mean, what would you say to somebody who said, I don't really care if acupuncture works, it makes me feel better, so I'm going to keep doing it?
Well, it's a free country. I don't think it should be provided by this. I don't want to pay for it with my taxes. That's the kind of bottom line. And I think that what often happens too, what the practitioners often say is, not only do you have to use it when you're ill, you're meant to use it when you're well, because you've got to keep your energies in balance through the treatment. And so it's not simply, it's worse than what you're describing, somebody with a slight pain, it's somebody with no pain. And say with chiropractic, it isn't risk-free because they use x-rays all the time to no obvious benefit. And it's not good to have too many x-rays. They do things as I said, that can kill you, rarely. So
there's apparently a big, not a huge risk, but there is some risk of getting a stroke from chiropractic.
Yes, from neck manipulation.
That happened to Kevin Sorbo of the Hercules TV show. I don't know if you guys got that. If you didn't, you're better off for it. Oh no! Oh no! But yeah, it's definitely a risk factor. Now, like I said before, your book works as a good entry point for people who are kind of unaware of everything. And we were talking earlier about how in your book you have these list of things to spot a quack, top 10 ways to spot a quack.
Yeah, I brought just a little précis of it. But
so, just to give people an example of the kinds of things that make this book such a great resource.
If I can find it. One of the things, I've got my top 10 tips here, and I'll rush through. The first one is the universal diagnosis. They diagnose the same. A quack will diagnose the same thing in everybody. So whatever you turn up with, it's because your pH level is shot or whatever. So that's the first one. Something being based on ancient wisdom. This has been used for 2,000 years, or not, as we know.
Because everybody knows people in ancient times were in tip-top health.
Hugely healthy, yes.
They lived upwards of 20, 30 years.
Yeah, I know. It's fantastic. Yes, absolutely. They tend to treat chronic conditions. They don't, and ones that with ambiguity in them, so that you can't quite tell whether you're better or not. So, as I say, there's no homeopathic contraceptive. You'd know if that didn't work. So it's that sort of vague, woolly-edged and chronic condition. They always use disclaimers for obvious reasons. They do a lot of flattery, and I think that's a key thing in this. they tell you you're pretty damn marvellous, and that nobody quite understands how marvellous. And you have your inner powers that I am going to help you find and be the person you know you could be. And it'll cost you however much. And that you're an individual too. And the individuality thing is quite useful because it means that if you hear of somebody else's treatment not working, you don't need to worry about that because it's you that it's being targeted towards. And say with Brzezinski, he talks a lot, doesn't he, about tailor-made, genetically defined individual treatments. But in fact, it is a cocktail that it's the same for everybody, isn't it?
Yes, and that's particularly, well, it's his treatments are interesting, and it's particularly insidious what he does, and it's not dissimilar to what a lot of people do. So the main thing that Brzezinski, I guess, touts as his breakthrough is this therapy called Antineoplaston Therapy, where basically he thinks he's discovered this, I believe it's a peptide that exists in healthy people that doesn't exist in people with cancer, and so by injecting you with this peptide, then you will cure your cancer. But most of the people who go to his clinic actually receive this tailor-made treatment, which is a cocktail of traditional prescription drugs, but
including chemotherapy drugs.
Including chemotherapy. And he analyzes you somehow and figures out which combination of these drugs work best for you. But they're as Dr. David Gorski, who writes for the Science Based Medicine blog, who writes this ORAC, I think that's not really a secret anymore, he points out that there are a lot of actual doctors who are starting to do things like this, looking in more detail at a patient's medical history and not giving, one-size-fits-all medical treatments. So what I mean by insidious is that it's sort of using medical terminology and using trends in traditional medicine, or not traditional medicine, but modern medicine that works, medicine.
Also known as,
It's using those sort of keywords and catchphrases and wrapping their nonsense in that.
Yes. And it leads to the next thing in a way, that the cover that gives you when you see other people getting sicker is similar to the you'll get worse before you get better, the healing crisis as it's known, which pretty much, I think, only exists in alternative medicine. I think there aren't any other treatments. There aren't treatments in orthodox medicine, really, that you could say do that. But it's a wonderful get-out. It's beyond belief what a wonderful get-out it is, really, when you think about it. I'm getting sicker and sicker, doctor. Good. That's marvellous. I would have been worried if you'd come here and said you're feeling a whole lot better.
Called you a liar to your face, kicked you out of this office.
Anecdotes and testimonials, we know about that. That's because that's all they've got, and you don't know whether they're true or not. Suppressed by the establishment. The cure the doctors don't want you to know about because they'll lose their huge riches if you know about them. The brave maverick, which is what Brzezinski is, isn't he? A brave maverick, or the lone genius, what somebody earlier on was calling the Institute of Bob, the single person who...
Brzezinski in particular is a brave maverick who happens to live in a giant mansion.
Yes.
So.
Yeah. And the 80% success rate, which I think is a fantastic figure to come across, they all pretty much say 80%. If it's a cancer cure, sometimes they say 70% because they don't want to, really over-egg the pudding. And I discovered this all over the place, that there was 80%. And when I got pictures in my book, and I went to a Chinese medical practitioner because I wanted to get some herbs to take photographs of. And I thought the best way to get them was to go and have a consultation. And she just followed. It's like she had this as a crib sheet, pretty much, in front of her. And I got to the point of saying to her, I think I asked her for menopausal hot flushes because I knew a bit about them. And I got to the point of saying, how successful is it? How does it get? And she actually came up with the 80%. Well, we find 80% of people, and I could hardly believe it, but there it was. So look out for that. And the final one is that if they say if it's too good to be true, if it sounds like that, it is too good to be true. It's not true.
How do you suggest people who are concerned about this sort of thing deal with it? I know in different countries there are different institutions and different problems, but just in general terms, do you think it's a bottom-up approach? Do we tell our friends and neighbors that what they're doing is...
I think it's a difficult problem. I find it really difficult because it feels so... people perceive it as if you're saying you're an idiot. And you kind of are saying that quite often. And I don't want to be the person saying that, even though I called my book Suckers, which, you know, is a little bit confrontational. It is now. It's become like politics and religion. If you start talking about this when you're with friends, we all know it goes down extremely badly.
Mm-hmm. Yeah. Do you have any personal experience with that? I mean, anything in particular that kind of pushed you over the edge, sort of getting back to the beginning of our conversation about what inspired you to...
even though I'd been interested in it for a long time, the thing that really pushed me into doing it was a very tragic case of a neighbour of mine who had liver cancer and was being treated by a medical intuitive telephone healer for it, and wasn't having orthodox medicine, wasn't having pain relief for a very long time, I think right until the last few days, wasn't seeing his friends because she told him not to because they were saying, I don't think you should be doing this. And it was absolutely, and he died in terrible pain. He didn't make a will. His separated wife and his children hardly saw him at the end because of all this. And, you know, that's the kind of, obviously that's a very, very hard case, but that was what, and I just thought, I can't be doing this anymore.
What was this healer claiming to be able to do over the phone?
She can generate white light heat energy from her heart. And you don't laugh. She uses quantum energy for this.
Now it all makes sense.
Yeah, and channels it that she can perform surgery down the telephone by the power of her energy and mind.
And where was this person? That seems like it would be illegal in most countries.
Well, I think the telephone thing is a really good way of doing it because you can't really pin her down. And she originally is Australian, but she works in Canada and from Canada and Britain. It doesn't matter because she's on the phone. You know, she doesn't have to be physically seen. But she's worth physically seeing. She's called Robin Welsh. I recommend you to have a look at her website.
Google image search?
Yep.
Okay, so I guess we can take some questions now in these last several minutes. Do we have a microphone ready? Andy is moving. He has something in his hand. He tapped it. Appears to be a microphone.
So amateur, isn't it?
If anybody has any questions, I guess you could just line up at the mic. No, there's one.
Hello.
Hi.
Hi. I just want to go back to sort of what's the harm with these things. Obviously, there's the more direct sort of the harm that you can do to your neck with chiropractor, the way that it's instead of other treatments, but also sort of more widely, not only is it seen to this pseudoscience has been infiltrating science, it's almost as if it's replacing it. And is that a slippery slope argument, or is that genuinely something we should be worried about?
I think it's this. The problem is this parallel universe that gets created that by alternative medicine, with all the sciencey words, the sciencey sounding bodies that they have conferences in and publish under, and that certainly in the wider world gives them credibility in terms of the world they're trying to reproduce. I think they need to be more confrontational. I think, for instance, GPs should be give a bit more welly, really, and not be so accepting of alternative medicine. I think very often they do it because they've got intractable cases of people they call heart sink patients, and they say, well, some people find acupuncture very helpful, and they shift them out. And I think they should be a bit more, or a great deal more robust.
Thank you.
It seems to me that quite often people use alternate medicine because they think it's more important to feel better than be better. Is there some way that normal practice should improve to kind of make people feel better as well as be better?
I think it's very hard to do in the whatever it is 4-minute consultation. You can't do in the 4-minute consultation what a homeopath can do in an hour. So to that extent, I don't think that can be reproduced. And the thing about the homeopath, that's all they've got. And so they have to give it heaps on that first consultation because there's nothing else they can do. So we shouldn't be too hard on the orthodoxy because they do have other things they can do apart from the caring bit. But they also, I think, can use what used to be called bedside manner is a very helpful and vitality imparting thing, and they should be confident that they can do that and trained perhaps more in medical training schools to do that.
Do you have any idea how much training doctors currently receive for that sort of thing?
No, I think I've heard it's less, and I think also they don't get enough training in alternative medicine either, in how to counter it. Obviously not to do it, but yeah.
Mm.
Hello. Do you have a view on alternative medicine regulation, such as the CNHC? Do you think they do harm, good?
Or nothing at all?
Or nothing at all?
I go the nothing at all route, yeah. Yeah, I mean, there doesn't seem to be any reason to think that they'll make any difference, or that evidence-free practices will be stopped. Yeah, so I think it's really. I think there are a lot of things that should be brought, if possible, within the sphere of the regulatory authorities that already exist, such as NICE. I think they should be much more robust about, say, homeopathic medicine. I can't even say the word medicine in that respect, but homeopathic products, yeah.
Now, homeopathy seems to be way bigger in Europe than it is in the U.S. Do you have any idea why that is, other than the influence of your wonderful prince?
Well, no, it's and the Queen.
Oh, the Queen.
The Queen's heavily into it. Well, it started in Europe. It's still very much part of, a lot of orthodox medics in Europe use it alongside, and Edzard Ernst was trained as a homeopath originally, as well as a medical doctor. People like it. We do have to accept that. People love it. Doctors like giving it out because their patients like it. The patients like it. Nobody comes to any great harm when they're having their sugar pills tapped around on their little lid as they take it. And people, because they like it, want more of it. But that's a different question. But that is why it's popular, because they like it.
Assuming a doctor is or GP is up to speed on the dangers of alternative medicine, do you think they actually have a role to play if a patient says that they're taking some alternative therapies?
I guess it depends what they're taking it for. I mean, it depends on the case. I think a friend of mine in Australia told me that a friend of hers is a GP in rural Australia and has got a sign up in the waiting room saying, "We practice evidence-based medicine only." And so it's a very public commitment to that. And I think they could do more of that. And in itself, that would perhaps undermine the alternative.
Who do you think is doing the best work to combat alternative medicine and its slow creep into society these days? Who's communicating it well?
I think generally, somebody was saying in the earlier, I think Andy from Clicometer was saying that we've got to a point now where comics on TV make jokes about homeopathy. That wouldn't have happened 10 years ago. So I think I wouldn't single out any particular body. I know that when I first put up the idea for that book, the response I had from some agents and some publishers was, nobody wants to hear that. Nobody wants to know that stuff. That you could perhaps do alternative medicine, boon or benefit or disaster, some sort of so-called even-handed book, which I was never wanting to write. But I think the climate has changed because of what's going on in the States. I took a lot of inspiration from people making it funny in America. Penn and Teller's work about the stuff they did on TV about alternative medicine was really, really funny, but full of facts. It was fabulous.
I know we're working for the James Randi Educational Foundation. I work with Randi a lot, and it seems that I think by far the most popular thing that he's ever done, people come up to him all the time, is the video of him from his TED Talk, I believe, taking an overdose of homeopathic sleeping pills. And people just find that on YouTube. It's insane how many people have discovered all of this wider world of skepticism of these sort of things through that one video. And I don't think there's much of a better visual representation.
No, so those kind of stunts are great, and they, I suppose, people don't experience them as the "you're an idiot" kind of stunt, and certainly with the anti-homeopathy thing that we all, a lot of us did a couple of years ago.
1023.
Yes.
Organized by the Merseyside Skeptics, actually.
Yeah. And that was great. That brought together that kind of energy, and it was funny, and it was ridiculous, and it also got people saying, "Are you sure? Is it really only sugar?" And they also, when we did it outside, I joined the group doing it outside Boots, and they had security people, and I think they thought we were going to come in and kind of trash the homeopathy display, but we didn't, as we should have.
Yeah, homeopathy is easy though, because it's just explaining what it is to people, I think, is enough. Because I can't remember where this was exactly, but there was one instance where there was a debate with a homeopath, between a homeopath and a skeptic. And the skeptic was saying, well, this is diluted. You just dilute this over and over and over again. And it was like, no. The homeopath said, no, that's not what it is. You don't just dilute it. You also have to shake it. He's making the point for himself.
Yes. Well, I understand that homeopathy is a terrible thing to learn. It's incredibly complicated, and because it has its own sort of internal contradictions all the time. It's absolutely, it really is difficult. So you have to bear in mind that all those homeopaths have invested a huge amount of energy into this brainwashing, I guess it is, isn't it? And they've not only invested the energy, they have paid a lot of money to do this thing, and so any doubts they have to put to one side and learn things that are absolutely either contradictory or mutually exclusive in all sorts of other ways, or just straight up and down nonsense, about people with blonde hair who like butter, who are pulsatilla, something or other, so you have to have the opposite of something when they've got another condition. It's hard work. We should respect them.
Yes, indeed. Next question?
Sorry, it's more of a comment than a question. I'm actually a junior doctor working in the UK, and you sort of mentioned about bedside manners and things. Medical education in the UK does actually put quite a lot of emphasis on communication. They do train us to have difficult conversations with patients. So I just want to say that actually that is part of our training, it's a big part of training. And you're saying about the sort of heart-sick patients. You do come across these patients where you've tried everything you can and they're still in pain or they're still having symptoms. So sometimes you feel that the only way to help that person is to perhaps suggest something out of the ordinary, not necessarily because there isn't a medical option that you've tried, but just because you still want to help them in some way if you seem to be helping them. But again, I can appreciate that kind of propagates the problem. And I do know a lot of medical professionals, when they have somebody come into them saying, "Oh yes, but doctor, I've tried this pill," we do encourage to try and actually challenge that view. But patients will often just they'll take your medicine, the conventional medicine, but put down their improvement to the herbs and things that they've taken. So it's a very difficult battle for us. Well, it's almost a battle.
But I suppose it's at the point where you're. I mean, would you suggest chiropractic to a patient with long-term back pain?
I personally wouldn't. I would actually suggest they go to a pain clinic.
Yes.
There are, again, sometimes it's a personal line.
Yes.
But if I've got, I wouldn't necessarily suggest alternative medicines to a patient, but some do. Some of the GPs do when there is nothing else for them to perhaps suggest. It'd be interesting to hear how you would challenge that and what suggestions you make for that person, that GP in that situation.
Well, I think I find it hard to believe that's the only possibility, that there's in fact, the homeopaths have got an acronym for it, which is TEETH, which is tried everything else, try homeopathy. And they quite like that because they get custom out of it. But I don't think there should ever be a point in a GP surgery where a medically trained scientific doctor suggests homeopathy. I cannot accept that. And I feel there must be, as you say, a pain clinic that isn't based on falsehoods and fairy tales is a better place for somebody to go, or an equivalent, whatever is appropriate.
That's very true. The other side of this is also patient choice. A lot of patients will come in and say, I've heard of this. And again, to stop, we want to move away from medicine being a paternalistic thing and saying, doctors are right, we tell you what to do. Patients say, I want to try this, and it's worked for so-and-so, so-and-so. So I agree that, ideally we would never be in the position of saying, actually, this doesn't have evidence if it doesn't work. If you've got somebody in front of you saying, I hear it has worked, I want to try it, and I want to try it. It's just very difficult, and I just wanted to point out that.
No, I appreciate that, but I think that I think we have to find a line to draw.
I'd just be interested in the other solutions of finding that line. Thank you.
Thank you.
Hi, I have the perception that the lion's share of the quacklash is directed at homeopathy, and probably what's left of that, much of it is, thanks to probably Simon Singh, directed at chiropractic. Do you share that view? Do you feel that perhaps we ought to have more backlash against other forms of alternative medicine? For example, if you do an internet search for whether hypnotism works for particular medical conditions, it's really difficult to find anything substantive about whether it works or whether it doesn't. Do you have that perception? Is there anything we should be doing about it?
Well, I suppose there's more done about more of things that are used more. And I think also it does come down to the kinds of claims that are being made as well. It's related to that. So it may be, I don't know, particularly anything about hypnotism, about whether it makes health claims. And so I think you have to stop somewhere. If it's a question of, and maybe hypnotic treatment is the place you stop. Or not stop, but put to one side to concentrate on something that's being used more frequently or making bigger claims.
Thank you.
Sorry.
Okay.
As well as being useful, some of these things are can be actually harmful. What would you say was the most harmful thing you've come across in your research into alternative medicine?
I think it's difficult to really say, and I suppose ultimately people missing out on what might be a curative treatment probably is whatever thing they're choosing. That's the worst part of it. In terms of the kind of what's the harm top 10. I don't know if anybody's done any work that could show that one's considerably worse than another. So I can't help you with that. Sorry.
I'm a GP, and I take a pretty robust line against alternative medicine. Thank you. We've got a local hospice, cancer centre, and they've got some fantastic doctors and nurses there who offer really superb quality of medicine there. But they've got a day centre that has a complementary therapies service as well. And they offer things like reflexology, light therapy, hypnotherapy, and it's really relaxation treatments, which I think people do get benefit from.
Yeah.
That's a small group of people that I have a hard time saying don't go for it, because I think they are getting benefit from it, but it's just the label it's been given in terms of complementary therapies. Just wonder if you have a thought on that at all?
I think it's a huge problem, and I think that it extends not just within the hospice movement, but even into the cancer charities to some extent, because nobody wants to be nasty to a cancer patient, which is fair enough. And to say, you've got cancer and you're an idiot, it's not great. And I think it does need to be taken on, and I'm trying to myself to some extent, because I'm a bit active with Macmillan, because I've had cancer myself. And so you're allowed to say stuff when you have. It's really, really difficult because, as you say, something like a nice massage is in the hospice must feel marvellous, but not. And I don't think they do make claims for it. Well, they won't be saying it's going to make your cancer any different, will they, when they go in and do that?
No, but they are referred by the doctors and the nurses there, so it is legitimate.
But I just think it has to be called out in a way and described for what it is. And so people get a better idea and perhaps don't get misled into other things, because that's the risk, isn't it?
Yeah. And also you mentioned about the alternative people using it'll get worse before it gets better.
Yes.
And obviously chemotherapy is the classic case where people do get worse before they improve. Obviously, do you think they're taking their lead from chemotherapy?
No, I think it existed before that, and I think the chemotherapy thing is different because it is. It's a kind of different mechanism that's being talked when people talk about being ill on chemotherapy. It's not the same that the alternative practitioners see the healing crisis is the actual illness itself getting worse rather than the treatment making you ill. You see what I mean? I think that's how it's differentiated in that way. So I don't think people confuse the two myself, but I don't know.
Okay, I'm afraid that's the last question. Apologies to the three who are in line, especially Alan. Any closing remarks, and then if we can just keep it brief and finish.
Yeah, I just my only sort of parting thought here is I hope people check out the book, and I think it's a great book, like I said, to give to somebody who's not very familiar with this. I think something that we maybe didn't touch on is how funny a lot of these stories are. I mean, there are a lot of stories of people who have been hurt by things, but a lot of them are pretty amusingly ridiculous as well.
Yes, because it is laughable, a lot of it. So we should laugh.
We should. Ladies and gentlemen, Brian Thompson doing a wonderful job of interviewing Rose Shapiro. Thank you very much.